One of the complications usually the surgeon worried about after gynecomastia surgery and during gynecomastia surgery is the bleeding, and post-operatively if it happens it becomes a hematoma. So how to avoid this complication? We are in more than 4,000 gynecomastia surgery till today. So we have seen a lot of bleeding complications in our practice, but last 1.5-2 years I can say that we have very minimal bleeding incidences happen. So only few advices from my side. So when you are doing a gynecomastia surgery, you'll be injecting the adrenaline solutions, tumescent solution inside, so that most of the blood vessels are constricted firm. So sometimes the bleeding might not be visible during surgery. So we in our practice, when we explore the hematoma, usually the bleeding points are in few areas. So when we try to understand where are these bleeding points, we found out that thoracodorsal arteries, perforators, anteriorly, what are the perforators coming through from thoracodorsal, that blood vessels, perforators are the commonest reason for the bleeding post-operatively. So what you want to identify, understand the perforators, where it is located. It's usually located in the side of the chest and upper border of where the pectoralis muscle curves. That area there is a perforator located. So these perforators you have to cauterize even there is no bleeding. These areas randomly you cauterize these areas during surgery, and sometimes one perforator comes from here. So when you cauterize these areas randomly, even it is not bleeding, it helps in reducing the bleeding a lot, along with the wherever other bleeding points. So one more main problem is the hypertension, the high BP. So if you found high BP before surgery, well control the BP and take him for surgery, and post-operatively check his BP periodically, so that if his BP is high, give him the antihypertensives and reduce the BP, so we can avoid the bleeding if you control the BP pre and post-operatively as well as intraoperatively. And sometimes accidentally we find young guys, sometimes accidentally we found high blood pressure during surgery. So post-operatively monitor them and understand, then try to reduce the bleeding so that you can reduce the hematoma complications. One more thing is the compression garments. Immediately after surgery, try to apply the compression garments as early as possible so that we can avoid the bleeding complications. Sometimes your size won't be ideal for the particular person what you have, so try to you better apply a dynaplast and compress it nicely. So you take the measurement and get the garment for after 2 days, then you make them wear the garment after 2 days. So even pre-surgery you have to check the bleeding parameters, and if the bleeding parameter is normal and you've done all these precautions, you can avoid the hematoma and the bleeding complications almost every cases.